Tessah, your board-certified dermatologist here in the province of San Fernando City, La Union. And this is my video on post-CO2 Laser Instructions. So, if you've had a CO2 laser procedure, what are the things that you should do, or parang your aftercare or skincare routine? And this is what I instruct my patients, and I would like to share it to you. If you are my patient, or if you want to have this procedure done in a clinic near you. So, number one, I usually tell my patients not to wash their face for at least 24 hours after the procedure. Initially, you will notice it's red, it's swollen, it's warm, hot, painful, ganyan. So, just don't wash it muna, because ideally, if you after the procedure, the provider or dermatologist has had creams applied on it, there's already sunscreen, so you really don't have to do anything with it. So after 24 hours, you can cleanse your face na with a mild soap. I don't have them use any harsh soap on their face kasi of course, it's like a controlled burn. So it's like you burned your face pero through a laser. Controlled siya. Hindi lang siya yung outright burn like nagpa-sunburn ka sa beach. So, it's nice if you could use like a cool water for washing your face. It's soothing kasi if you use cool and then just don't use any harsh or like matapang na sabon on your face. And then what else? Ideally, you could apply cold compress, not just right after the procedure, like the following day, kasi you will feel it's warm pa rin after the procedure. So apply a cold compress can soothe your face. You can do it like 3 times a day, but do not apply the ice directly on your face. Okay, so just parang naka-ice pack siya, or you could just like put like a cold towel in the freezer, just apply it on your face. And then again, I always tell this not only to my patients who have the CO2 laser procedure, and all patients, you have to apply sunscreen, okay? At least SPF 30. For here in La Union, I recommend SPF 50 talaga because mas better talaga pag higher. But okay, the guidelines say that at least SPF 30 is okay. And then, how much sunscreen should you apply? 2 finger length full for your face and neck. So, that much sunscreen if you go out. If, for example, you run errands, pumunta ka, naghatid ka, nagsundo, naglakad ka, and then napawisan ka, ideally, you have to reapply because the sweat, it will remove the sunscreen on your face. So, you have to retouch na. And then, what else? You have to apply moisturizer. I tell my patients to apply liberal amount of moisturizer to soothe the skin, to protect the skin. At least 4 times a day. If you can do it more often to at least soothe the skin, that's also okay. And then it can also relieve the skin of the redness, and sometimes it's itchy na. And then this one is a really important thing you should know. You should not be exposed to the sun. So bawal maarawan. I tell them, hindi naman talagang bawal na bawal. Syempre, we have to do things. We have to go on with our life then. You have to limit sun exposure. So, don't go to the beach, diba, right after your laser procedure. Don't have like an like strenuous workout activity sa labas because it will retard or slow down the healing process. So, at least 7 days, if you can, diba, that's what I tell my patients. Huwag muna magpa-araw, huwag pumunta sa beach, magpawis, mga at least 3 to 5, or if you can, 7 days, that's better. Okay? And then, when you do go out, you have to wear a hat, yung malaking hat, wide brim hat, sun visor, an umbrella. You have to protect your face so that it won't burn, and then it will heal faster when it doesn't burn. You have to be in the shade and do not go swimming. Okay? Wag mabilad sa araw. Ideally, you could sleep with your head elevated for the wound healing to be better. So, mga 2 pillows is okay, so that mas maganda din yung pag-heal, mas mabilis if you do this one, yung with the pillows. No excessive sweating or exercise like I mentioned a while ago, because the sweat or the heat, it will retard the healing. No sauna. So, there are some patients mahilig mag-sauna, yung they like to work out and they'll go to the sauna. So, hindi, like I said, no sweating. So, you can go to the sauna. Yung katumbas nun sa mga mommies, like, who like to cook, mainit yung singaw ng niluluto, wag itatapat yung mukha doon, or any kind of like steam, don't go near it. Okay? And then, do not pick on the scalp. So, for example, you had a CO2 laser procedure to remove your like facial warts or some seborrheic keratosis, some some skin tags, there's gonna be a scab. Don't pick on it because there is an urge to pick kasi medyo itchy na siya when it's about to fall off. So wag kutkutin, don't remove it because it will slow down the healing process. If it takes like a week for it to heal or 2 weeks, it will take longer if you remove that scab. And then when washing a face and taking a bath, don't use hot water, because anything hot will also make your skin more red. So it's not really good, especially when your skin is healing. So you could use like a lukewarm water if you're not used to taking a bath with cold water. But iwasan na lang na tumama masyado yung warm water on your face. Okay? And then drink lots of water. Water is very good because it is like a controlled burn. So it's like you burn your face in the face. You burn your skin pero sa face lang. So you have to drink lots of water so that your skin will be hydrated, and then it can also cool you down. And then rest. Huwag magpa-stress because any type of stress can slow down the healing. And then what else? My reminders, I usually tell my patient that the skin may be red to pink after the procedure. Sometimes days after, it can still feel itchy, and then it can scab. You can take a pain reliever because some patients mababa ang pain tolerance. So I tell them if it's really painful, right after you can take like a paracetamol or your pain reliever of choice. If you have like allergies for certain pain relievers, you can take the pain reliever of choice that it's okay with you. Then mas maging tolerable yung healing process. And then lastly is right for all my patients and those watching this video, please seek a consultation with a board certified PDS dermatologist within your area. Of course, this video is just it's useful to those who just like trying to know ano kaya mangyayari right after ng procedure if I have a CO2 laser. But all your questions ma-address yan if you go directly to your dermatologist. Thank you for watching my video. I do hope to see you in my clinic here in La Union if you're within the area. And then, don't forget to like this video, subscribe to my channel, and comment below. Ako mismo yung sumasagot sa mga questions nyo, sa comments nyo. And I do appreciate anything, any comment, yung mga napupunan nyo, just tell me, Doktora, yung audio hindi malakas. It's okay. I do appreciate all of that, and I do hope to see you on my next video. And you can also do comment some suggestions anong video yung gusto nyo mapanood from me. And thank you so much. Bye!